Hi, everyone. My name is Lorren Sandt. I'm the Executive Director of the Caring Ambassadors Program, and I am here today to talk to you about the Cures Hepatitis C Act of 2025. So, S 1941, Senate Bill 1941, requires the Secretary of Health and Human Services to carry out activities to eliminate the hepatitis C virus in the United States. It was introduced by Senator Cassidy and Senator Van Hollen as a bipartisan bill in June of this year. So the CBO estimates that this bill will save over $6 billion over the 10 years, and it really closely follows President Biden's hepatitis C elimination plan. Some of you may remember Francis Collins from the NIH. Well, Francis lost his brother to hepatitis C, and became a passion of his, and he wanted to take it on for the president and make it happen in his term. It didn't happen. It was in the budget, but at least we do have a bill now, and it establishes a test to treat model for hepatitis C. So hopefully we can move this forward. I'm going to talk about some of the major elements of the bill. It has a subscription model similar to what the state of Louisiana did, Washington, the VA, and others to follow purchasing of the direct acting antivirals to cure hepatitis C directly from the pharmaceutical companies. And then it also creates an infrastructure to treat individuals in the settings where they access care. So to start with, it provides 4.283 billion in authorized and appropriated funding for 2025, and then everything remaining through FY 2031. So it's a 5-year mandatory spending program, and the funds will support public health, infrastructure, screening, and linkage to care. So it really invests in the public health infrastructure. It improves the outreach to covered individuals, to increase at-risk individuals with the availability of the cure, increases rates for screening and diagnosis of hepatitis C. It supports coordination and delivery of healthcare and social services, and it improves the public health capacity and capabilities for hepatitis C prevention, detection, diagnosis, treatment, outbreak preparedness, and response. So where's this money going to go? States, political subdivisions of states, and other entities like public health departments, community-based organizations, health providers, and facilities will be able to apply for funds. Opioid treatment programs, certified community behavioral health clinics, tribal clinics, community health centers, and correctional facilities. The goal is to treat Medicaid population, the uninsured, the prison population, and Indian health services. So what's the bill do for patients? Well, if you need a specialist, you're going to be able to get to a specialist, but most of the people will be treated in their health centers with their primary care docs where they actually are currently getting their care. It will improve the hepatitis B screening. It will coordinate with hepatitis B linkage to care and make sure that people that are getting screened for hepatitis C and accessing treatment know their hepatitis B status, as we know is so important. And we need to get more people linked to care with chronic hepatitis B. So this should be good for both B and C. Activities will be coordinated with other federal efforts and our hepatitis C plan and our goal to eliminate hepatitis C in the United States. So point of care testing. The secretary can enter into agreements to purchase point of care testing for the facilities that want to increase testing for hepatitis C, but also they're going to put $20 million towards the development of a point of care test for hepatitis B, which is so badly needed in this space. It will establish a national network to provide training and technical assistance for implementing hepatitis C prevention, diagnostic care, coordination, and treatment of the support of the program. And it will create a national public awareness and education campaign related to hepatitis C treatment and the related activities of the program. I have a few concerns about the bill. Overall, I think it's great. I want to see the bill passed, but I want to see some changes made. First off, Section 10, use of funds. The bill funds can only be used for a U.S. citizen or a legal immigrant. And this is a problem for federally qualified healthcare centers, FQHCs. They do not check status. They are required to treat everyone in their area, no matter their status. And so for them to have to get this this paperwork that they don't normally do, it puts them in a bind. Not only will they are at risk for losing their own federal funding because they're not caring for someone within their remit, but they can't accept the funds if they have to discriminate. So it makes a problem. I think we need to change that language. I think that language needs to be removed. The manufacturer bidding process is definitely a problem, in my opinion. How it works now is the bill is written is that the manufacturers will bid, and the person who has the lowest price, or the manufacturer that has the lowest price, will receive 100% of the bid, or if they decide to split it up, they'll get 70% of the bid, and then the other manufacturer will get 30%, but have to abide by the price of the lowest bid. So we may lose to shared decision making for doctors and patients. And in the case of acute hepatitis C, if AbbVie is not in the mix, then we won't have that option of treating acute hepatitis C. A maybe even larger concern for me is that HHS will have control over these programs. So RFK Jr., who, as you heard this morning, has directed his panel of vaccine experts to change decades-long hepatitis B recommendations, is going to be the person who's going to be in charge of putting this program together. An additional issue is the House has not introduced a bill yet. There are rumors that the bill is being written. There are rumors that the bill is being written without consultant to the Senate, so it may be a completely different bill. We don't know, but that always causes a problem and makes it less likely to get through passage. But my final concern is the person who introduced the bill.
My patients, thank you. My patients who have passed, thank you. Because there's not been someone such as you through the years to advocate for solutions to their health problems. And now you're here, and fortunately 20 years from now, I'll be able to say, for the last 20 years we've had the ability to address this illness, unlike now where I say for the last 20 years we've not had enough ability to do so.
That was 2010, and that bill had been reintroduced several times when Representative Cassidy took it over, and he promptly killed it. Today he's leading this bill. Questions?